If you have a single gene mutation, you're a carrier for a disease, we can very, very accurately diagnose that in the embryo and preferentially transfer embryos that don't have that disease, usually a lethal disease. We can transfer the healthy embryos, sure. But this idea of just screening everything, it can't be done. You can count chromosomes, and that's all that this is, PGS, or genetic counting chromosomes on every embryo. But that lowers the pregnancy rate because you're going to misdiagnose many embryos as abnormal and throw them away that would have been a baby. And the reason is, or one of the many reasons, in the first place, the technology isn't perfect. 5% of the time, if you diagnose it as a girl, it's really going to be a boy. So the technology is not perfect. Right there, there's errors. But also, just the biology. The trophectoderm, or that part of the embryo we biopsy, which will become the placenta, is filled with abnormal cells. The placenta works perfectly well with 100% abnormal cells. So there's always going to be abnormal cells in that placenta. And so when you biopsy it, you're going to have normal and abnormal cells, and it becomes really problematic to try to interpret what the embryo is from what you're biopsying. And you're certainly not going to biopsy the embryo itself, because you would really damage it or cause defects. Everybody knows that. So there are certain indications for doing genetic screening, but the patient, you have to talk to each patient individually about it and see who might or might not benefit from it. That's not the same as genetic testing. PGD, really accurate. But if you're not a carrier of a particular disease, then the genetic testing is very questionable. We see so many patients, older patients particularly, that have had this testing and been told, well, they don't have any normal embryos. And we do IVF with mini IVF, and they get pregnant and have babies, and we don't have abnormal babies. So you got to be really careful about that.